Pope Francis is getting ready to deliver his weekly Sunday blessing from the hospital. He is recovering after undergoing surgery for diverticulitis. The Pope is said to be in good condition, but it's also important to know what diverticulitis is and some of the common treatments for the disease. Joining us this morning is Dr. Crean with Memorial Health. Thank you so much for stopping by.
Absolutely. Thanks for having me, Zach.
You know, when I think of diverticulitis, I think of my grandmother, and I believe she had a few instances or flare-ups. And I remember her talking about how excruciating it was, the pain.
Absolutely.
What is diverticulitis?
So diverticulitis is when we develop these little pockets on the outside of our colon that can happen to a lot of people. But there is a small subset of patients that actually get these flares or acute inflammation, and it can cause significant abdominal pain, fevers, change in bowel habits, sometimes requiring hospital admission.
Who is at risk?
It's a really good question. So we're still learning more about it. There's definitely a genetic component to it. Diet plays a role as well. If you have a low fiber, high fat, high red meat diet, that seems to play a part. We also do think there's a role with smoking and obesity, but that's still being studied.
I recall her saying something about not being able to eat fruits with seeds, strawberries, raspberries, those types of things.
That was a thought before. We're probably coming away from that because we do know that fiber actually does help with diverticulitis. But when people do have acute flares, we ask them to hold off on foods like that.
So we know the Pope reportedly had surgery for this condition. Is that a common I know you said some extreme cases do require hospitalization. When we talk about surgery, though, are there ever cases so severe that need to undergo a procedure?
Yep, absolutely. So it's a very small subset of patients, but there are some patients that require emergency surgery, and then, without being on the Pope's medical team, based on what's being reported, it seems like his was more elective, but he may have developed what's called a stricture or a narrowing of his colon from repetitive flares or attacks of diverticulitis.
And so what would the surgery be to correct this?
Good question, Zach. So really what you do is you want to find two parts of healthy colon or large intestine, take out the parts that's diseased, and then reconnect.
So you're shortening the colon?
Correct, exactly. Yeah, and you're taking out the part that's either chronically inflamed, narrowed, or just causing you a lot of symptoms.
Is this invasive as far as recovery? Does it take a lot of time?
So, a lot of the time now with this type of colon surgery, we're able to do it in minimally invasive techniques, either laparoscopically or robotically. So it definitely shortens the amount of time people are in the hospital and helps you get home faster.
Will this prevent future attacks?
It can, and that's the thinking about doing surgery sometimes, is when you've had so many attacks, your quality of life is affected, so you want to do the surgery to prevent you from having any in the future.
One who has a surgery like this, can they anticipate having to go to the restroom more often?
Yeah, that's a great question. It can be a side effect afterwards, but typically we have a lot more large intestine or colon than what is removed. So long term, it usually doesn't have any significant effects.
People at home right now watching, if they have diverticulitis or know someone who might have it, what are your suggestions on maintaining a healthy lifestyle while dealing with this condition?
Great question. So it's really just an healthy lifestyle. Stop smoking or cut down on smoking, stay active, eat a high fiber, low fat diet, try to modify your red meat. That's really what you can do to help yourself out.
And at what point should you have a conversation with your doctor?
If you're ever having severe symptoms like pain that's not getting better, inability to eat, even bleeding sometimes, you really want to talk to your primary, your gastroenterologist, or a colorectal surgeon like us.
And for more information on diverticulitis, where can people go?
www.masjax.com. We have a lot of information on our site.
Dr. Crean, thank you so much for coming in this morning.
Yeah.
We appreciate it.